Sure. I think someone left. Before we start, we'll dispense with the modeling. Thank you. Good evening, everybody, and thank you for the opportunity to catch everybody up on where we are as a state and where we're going. First, though, acknowledge that I have a number of people that are here to answer any questions. The vast majority of those questions we'll take online and on the phone, not necessarily in person, as we're starting to appropriately practice social distancing. Let me, though, first acknowledge the anxiety that many families are feeling. I'm here with my family, my daughter, among others, my wife. We're starting our own homeschooling and working out the logistics, and I can imagine what quite literally hundreds of thousands, millions of people across the state of California, across the country are feeling as it relates to this reality coming into real focus. We're moving from planning stage now to application of a lot of the plans that we've had in place in the state of California, across this country, quite frankly, for years. Many of them updated to meet the novelty of COVID-19 and the challenges that are being described hour by hour, conversation by conversation. But that anxiety must be acknowledged, and that anxiety is real. And I just want to extend a deep appreciation for people's understanding and capacity, moreover, to absorb this moment in a very rational way. And there's no greater way you can rationalize this moment than to just practice common sense. To be safe, stay indoors, particularly our seniors. We sent out a very clear directive. If you're 65 or older, you should shelter in place regardless of where you live in the state of California. Clearly, there are new protocols and procedures that have been advanced at the county level. Now no longer just 6 counties, as was advanced yesterday, around home isolation. It will be now clear in the next hours and days that a number of other counties throughout the state of California will adopt similar strategies. It's now just time to absorb and recognize that we need to change our behaviors in a way that meets this moment and allows a recognition that this moment will pass, that we will work through the course of the next weeks and months, and we will get back to the life that we have lived. And I think that's most important, because I get people every day just asking, is this the new normal? This is a moment in time, and it's a challenging moment, and it may be many moments in the foreseeable future. But nonetheless, we will process, we will work together through this moment of challenge, and we will work through, and we will triumph over fear, anxiety, and this disease. Let me talk more pragmatically about what we think that looks like here in the state of California, the nation's largest state. Yesterday evening, I laid out a series of new guidance and directives to begin to flood the zone by taking huge workforce that was focused on licensing and oversight, on health and safety rules for a panoply of different state agencies, and now really focusing in on older Californians in congregate settings, assisted living facilities, skilled nursing facilities, our in-home support service workforce, some 520,000 strong, that help our seniors now that are self-isolating to make sure meals are provided and prepared and to make sure needs are met. We laid out a very detailed prescriptive guidance to begin that process anew. Accordingly, we wanted to meet the moment as it relates to new, deep anxiety around evictions, issues that transcend just individuals, many businesses that are worried about being able to pay rents, commercial establishments. We waived the California Code to allow local municipalities to adopt what is appropriate for them as it relates to moratoriums on those evictions. You saw already further advancements in the city of San Francisco, and I applaud Mayor London Breed for those efforts, Mayor Garcetti, Mayor Liccardo, San Jose, and Los Angeles had already advanced local efforts. We hope to see other local efforts throughout the state of California. And as I said last night, I'll repeat tonight, we reserve the right to go farther if we don't think the local efforts are meeting the moment. We also made the point that the Public Utilities Commission in the state of California needed more as it relates to oversight and management of our utilities to make sure people are not facing their gas being turned off, their internet being shut down, their water being shut down because they can't pay a utility bill or the like. I want to applaud the utilities in the state of California for acknowledging this moment and that anxiety and advancing their volunteer efforts to not turn off or disconnect individual customers. We just want to make sure from a consumer protection perspective field offices to get registration or get a renewal of your license. We're waiving that for a minimum of 60 days. If your license expired, you don't need to go in. If you're young and healthy and your license expired, you don't need to go in either. We, again, want to encourage a reduction in the queuing in these field offices and encourage people to utilize at least some patience and not be feeling the anxiety we all feel when our license or registration expires. So those were extended in orders last night, and we'll continue to make sure we monitor and we make sure the enforcement is appropriate throughout the coming weeks and potentially months. We also prioritized homelessness. I was very proud to make a call to Mayor Libby Schaaf of Oakland yesterday, let her know that 393 rooms were made available. The state of California was able to negotiate and procure the lease for 2 hotels to prioritize out in the streets and sidewalks that are vulnerable to COVID ID, as well as those that may be tested positive as a priority to get them off the streets into appropriate shelter. I want to make clear we recognize 393 units is not significant number. In real time, we are quite literally negotiating with over 901 identified hotels throughout the state of California, tens of thousands of rooms, a possibility to come into a portfolio that we can advance very, very quickly. And we can advance it for another reason. The California legislature acted with urgency. The leadership of the state did the right thing in record time, simply one afternoon session. They passed emergency bill to afford me the opportunity to be able to distribute over $1.1 billion state money to prioritize the procurement, not just of hotels and motels for our most vulnerable, but to secure facilities for child care for those children that are otherwise not getting that support because of school closures and the like, in additional support for our cities and counties. I just want to acknowledge that it took an enormous amount of, I think, trust in this administration for legislative leaders, Toni Atkins, and incredible leadership of our Senate and her colleagues, as well as the Assembly leadership and the remarkable capacity for people across party lines to say this is the moment we need to work together, and with unanimous support they advanced that $1 billion+, and we will use that money thoughtfully, wisely, but with a deep sense of urgency to meet this moment. We also recognize, in order to meet this moment, that we need to prepare for the capacity that will ultimately transpire if our projections materialize as it relates to a surge in our hospital system. And that's why you have a number of people that are behind me. We just left a meeting with all the leaders in the state, hospital leaders, some of the key representatives of our doctors and nurses and the like, folks that are on truly the front line. We talked about the current inventory of assets throughout the state of California, a hospital system, just to be specific, that includes 416 hospitals that currently has over 74,000, just shy of 75,000 licensed beds, 78,000 staffed beds, and a surge capacity of about just over 10,000 beds. So capacity of roughly 88,000, roughly 90,000 beds in the state of California. We're running every conceivable model. You've heard the phrase "are not." That's an individual that may test positive. We then would assume, in a modest assumption, that they could potentially impact, through no fault of their own, through the neglect or naivete, one, maybe two people, and are not two, with an attack rate that goes anywhere from, low ends in the 30s to 40s to higher end, 50 or 60% of our population. We run those models. We run those scenarios, and that allows us, based upon what we're tracking, not only across the state of California, but across the country, and more importantly, perhaps, with the benefit of knowledge from what's happened across the rest of the world, be it in China, what's happened in countries large and small, from Singapore to notably what's happening in real time in Italy, France, and Spain. We're able to determine percentage of hospitalization. We run those percentages against the attack rate and the R naught projections, and you come up with an estimate of what our surge capacity in our hospital system would look like. Low end, 5%. Hospitalization rate. Under a scenario, we could see a need for 4,000 additional beds. You get up to 20%, you're closer to 20,000 beds. So running those scenarios in anticipation and expectation that we need to meet that moment. Our hospitals have been running their own pandemic planning, their own procurement strategies, not just for physical resources, but the deep need for human resources and supplies. PPE, personal protective gears, the things that you hear often, the N95 masks, but even basic masks, basic gloves, basic eyewear, protective gears, gowns, things that are also needed beyond the COVID-19 challenge, just to take care of existing needs within our healthcare delivery system. So we had a very candid and a sober, if not sobering, conversation about where we may be and where we need to go together. The good news is none of it surprised any of us, that we as a state, working with our system, anticipated much of these needs and have been running plans to address them. I gave an example last night of two large hospitals that the state of California should have in our possession as early as Friday. We have one in Northern California, one in Southern California, very large hospitals that we can convert in real time. Now, with the $1 billion appropriation from the state, we have the ability to secure those on a lease basis and move to operationalize those assets. The 901 hoteliers that we are negotiating with also creates capacity opportunities. We're running opportunities to reduce care and standards without diminishing quality, by allowing us protocols and processes to move people through our assisted living, our long-term care system, and the like. So again, all these processes, protocols, and procedures, but not through the lens of the aggregate, meaning not through the state lens, but through the lens of our diverse communities in California. That the hospital system in Santa Clara County is much more stressed than what's occurring currently in Alpine County or Butte County. Of course, what's happening in Alpine County concerns us as well, where they don't have those hospital assets and resources, and how do we provide them in real time? That was the purpose of today's conversation, to get in more granular frame so that we can meet our projections and make sure that we're all on the same page. But let me make something clear. We need more swabs. It's interesting, we've had these conversations in this country in the last few days where people have heard the phrase RNA extraction. They've heard about reagents. These are components of the testing kits. I'll remind people, testing kits are like printers you purchase, but you don't have the ink. And if you don't have the ink, printer doesn't mean much. We have a lot of tests, but we can't use the tests because we don't have the RNA extraction kits. We don't have these reagents, these other components. And so that's been an issue that we've been very forthright working with the administration, CDC, and others, and they have been extraordinarily responsive to the needs of our state, and I believe all across this country, to do their best to provide for those resources. But now, as we move to greater throughput, as we move to greater automation of our testing protocols and procedures. And I'm very confident that the President and others are right, that in the next week or two, you're going to see an exponential increase of our throughput of testing capacity. It's incredibly important we be honest and sober about this. We're moving from the diagnostic side on the testing now to the specimen collection, where swabs now and some of the media related to the swabs can be an impediment. And so I had the privilege of a conversation quite literally an hour ago with the President of the United States. The President assured me, not only assured me, he was aware of where those swabs are being procured before I even offered my own insight in that respect, and committed, not only is he on top of it, but that they're securing and beginning the process of distributing those swabs. But that is going to be an impediment as we move to more mobile testing, which is critical to get people out of the acute environments, get them out of the hospitals, and get them into an environment where they're safe and our caregivers are safe and our other patients that may otherwise be mixing with them in our hospital settings are safe as well. That's why mobile testing is so important. We announced yesterday our partnership with Verily and the fact they started to conduct their first test in Santa Clara County and San Mateo County. Today, they have increased their test just from a modest 30, day one, to projection of 320 tests today. We'll get those numbers later this evening. It gives you a sense of how we can start to scale up our mobile testing. We want to distribute those mobile testing sites all across the state of California, and we have requests in with FEMA, our federal partners, to provide more support so that we can provide not just the swabs, but the personnel, those reagents, and the test kits, and the throughput with our commercial and our state labs. We have 21 state labs currently doing tests. We have 4 private institutions, hospitals, academic institutions doing tests. We'll have 3 additional ones up next week, in addition to Quest and LabCorp doing the commercial tests. So we're getting to a point where our testing regime, as I said, is improving and improving in real time. We want to just keep ahead of the curve and make sure we have those swabs and address some of the anxiety still with the reagents. We are focused on treatment. This is not something we're frankly discussing enough. It's one thing to talk about a vaccine, and we know the vaccine is sometime off, but treatment is not. And I just want folks to know, in the state of California, we pride ourselves on being a center of innovation, that entrepreneurial spirit that defines the best of the state. More researchers, more developers, more scientists, more engineers in California than any other state in America, and the finest institutions of higher learning. And we have all of our UCs already in clinical trials with treatments. And I just want to make that point. I'm not here to overpromise, but it's a mitigation strategy as we move to transition from testing those that are positive, trying to avoid hospitalizations, address some of the treatment needs. And there are many antiviral drugs, palliative care drugs that are in the testing process. And I'm just very pleased as we familiarize ourselves more and more with some of those testing trials that our own partners are working very collaboratively in the state of California to advance those efforts as well. So that's broad strokes what led us to the day. I want to just make a couple additional points, and then we'll open it up for questions. I was very pleased to hear the President this morning announce their support for telehealth. It is critical for the system that we provide telehealth, though not just for Medicare, but also for Medicaid. State of California, that's the Medi-Cal system. We put in a formal letter. It's called an 1135 waiver, 9 detailed pages to provide us more flexibility to allow for more telehealth, the same way we do in-person visits. Trust me, this matters to everyone behind me, and it should matter to you. It should significantly increase capacity and access, and I want to thank the President for his leadership in that space and announcing the Medicare side, and I have all the confidence in the world based on our conversations they'll be quick to support these waivers for Medicaid support at the state level very, very quickly. By the way, just as they did for SBA loans. And I want folks to know, because this deserves more attention because we need to socialize it, we were the first state proudly to request the SBA loans for financial stress, those under a disaster declaration, to be able to draw down loans up to $2 million. And this is under the SBA guidelines for employers up to 500 employees. These are 3.75% interest rates for for-profit, 2.75% for nonprofit businesses. We want to start getting those applications out. Go to oesnews.com, oesnews.com, if you're a small business person or know a small business person that is anxious about the moment because they've just shut down. Learn about those SBA loans and take advantage of them in real time. $2 million loans exist in that space, and we're encouraging people to take advantage of that. And I just again want to thank the administration for being quick to support California's efforts, and we can operationalize that throughout the state. And we are encouraging businesses in that category of less than 500 employees to do just that. So we've got the 1135 waiver. We've got the SBA waiver now on board. We, of course, are also trying to address in closing the issues around our schools. 98.8% of our schools have closed down. We expect the smaller rural districts with just 1.2% or so of the remaining kids, about 6.1 million children are now no longer in school. About, as I said, 98.8% of our student body. The rest will likely start to shut down. Again, we wanted to make sure that learning is still occurring, distance learning, the online learning, but we are diving deep into curating curricula, curating the capacity to deliver on what we're promoting, which is homeschooling your children. And in order to do so, today we announced and we put out for public distribution detailed guidelines for curriculum, also attaching links, PBS. It's a reason we should support public broadcasting. PBS has an extraordinary full-day classroom that everybody should be taking advantage of if they're not otherwise getting the benefit of their district support at home. There are many others that are out there, and we put them all out now for people to access. It's available not only for our districts to guide the districts, including those that are in the process of closing, but for all of those that have already closed. It includes congregate meals and how we're distributing our programs and how we're keeping certain parts of our school districts open and how we are procuring those meals, the grab-and-go meals, how we're looking at eligibility for those that are beneficiaries of free and reduced lunch, those that are not, trying to meet their needs still because the anxiety families are feeling. We laid all of those out in these guidelines. The guidelines are dynamic. They'll update every single week on Friday. To the extent they need to ad hoc be updated, we'll do that in real time, but there'll be a deep reset every Friday. And I want to thank all our school partners for being deeply participatory, but none more important than Linda Hammond, the president of our school system, and of course our superintendent of public education, Tony Thurman, that led a task force to design these toolkits. And I want to applaud them and our health and human service director for their collaborative effort to meet the guidelines we set out to get those out today, which indeed they have done. By the way, it includes recognizing the needs for caregivers and those of special needs, and how we to take care of those that are truly most vulnerable because the school day has shut down. Let me be candid. This is a very sober thing to say, and I can't say this with certainty, but I can say this quite learnedly. Don't anticipate schools are going to open up in a week. Please don't anticipate in a few weeks. And I say that because one needs to be honest, and I need to be accountable to you. I don't want to mislead you to 6+ million kids in our system and their families. They need to make some plans at a time when a lot of plans are already being curtailed. But planning with kids is some of the most challenging planning. I would plan and assume that it's unlikely that many of these schools, few if any, will open before the summer break. And as a consequence of that, I also want to make this announcement. Working with the guidance of our superintendent of public education, and Linda Darling Hammond, we think it is totally inappropriate for kids to worry about coming back and being tested. So at very least, let our kids know from a social and emotional perspective, if nothing else, and an equity lens, that we're not going to be requiring testing as long as our waiver that we are formally requesting of the federal government is supported. I have all the confidence in the world it will be, but let folks know, let those families and let those teachers and let our classified employees know that you shouldn't worry about coming back in the SAT, ACT, and AP exams and all these other exams when we already have enough anxiety related to this moment. So that's it on the education side as well. We continue, again, to be confident about where we're capable of going, but it is incredibly important that we all work together in a collaborative to communicate in real time the anxieties and fears. And I just want to close by making this point in recognition. The state puts out guidelines. It puts out broad strokes of where we think we should go and where we anticipate we are heading. It is, by definition, adaptable. And it's adaptable on the basis of what's happening by day to day. And as a consequence, these guidelines change. And one should expect they continue to change. We want to socialize that. We want people to come to understand that, not be fearful about that. As an example, I just remind you, seemed a year ago, it was just a week ago, we had guidelines in this country. Gatherings larger than 500 should be canceled. Some states, we were one of the first to say it should be 250. Some cities then said, well, it should be 100. Others said it should be 50. CDC guidelines. A couple of days later, CDC says it should be 10 people. I know that's frustrating for people. They just want to know, what is it? And I think people should just get a sense and understanding that everybody is understanding what's happening in real time, and these things must adapt to the moment. But it is important for people to know the shelter in place, broadly defined with all kinds of exemptions in the 6 Bay Area counties in Northern California, that will be extended to other counties and already has been in real time and over the next few days. They call for no gatherings. That doesn't mean that within your own social set, your own family, you can't have a barbecue. Doesn't mean you can't have a walk and use common sense in terms of getting your essential needs met with that walk in with intention to get food and get medicine and do the things you need to do. Or for those workers that are essential, to be able to get home and worry that you're in a car with 2 other people. That's not the point about the no gathering advisory that we're putting out for the entire state, not just those 6 counties. It's just common sense. We want to make sure that people you're used to being with, you should be with. But we just don't want activities that are independent of your cohort mixing with other cohorts, and then we have the ability to see more community spread. So again, no one should be alarmed by this. Just again, common sense, and I continue to just promote common sense throughout this process, and we'll do our best again to meet the moment. And finally, we want to make sure people know that their security is top of mind as well. We are putting out a little bit more formal action. We talked about mutual aid with our California Highway Patrol, the work we do on wildfires, well established in the state of California, work we do in the state of California around earthquakes, mutual aid system, simply second to none in the country. Again, not to diminish the incredible work other states are doing. Just a point of pride in California and a point of emphasis for any Californian, having lived here through some of the toughest wildfire seasons. We continue to prepare for wildfire season. We could continue to prepare for our mutual aid to be expanded and enhanced accordingly. The National Guard, we just put a little bit more guidance out today to encourage them to lean in more on the logistics side, make sure food delivery is happening appropriately, make sure people are appropriating themselves at our grocery stores without overreacting and getting a little too, a mindset of abundance, or rather, forgive me, the reverse, having a scarcity mindset that then begins to advance more of an abundance mindset in terms of hoarding. So we just want to broadly begin to socialize that we're going to support those mutual aid efforts from a humanitarian perspective, a logistics perspective, a food perspective, supporting our seniors and the like, and more formally supporting our counties and our cities throughout the state of California. Because at the end of the day, I've been a former mayor of a city. The reality is cities can only do so much. And when you are not capable of doing a little bit more, more and it becomes regionalized, that's the appropriate job, appropriate role of the state of California. And we just want folks to know we're leaning in a little bit more aggressively in that space as well. So forgive me the long-windedness. Been busy as all days have been. And I, again, deeply appreciate everybody's understanding and patience going through a very, very difficult and challenging time. But as they said, there's no leak on your side of our boat. We're going to rise and fall together. We will rise together through individual actions, through a spirit of collaboration, cooperation, looking not through the lens that we have so often looked through in this country, blue or red, urban, rural, but as human beings connected to common cause, deeply connected to the one universal spirit, to love and to be loved as neighbors, as human beings. We're all capable of meeting this moment with the spirit and the optimism that we, by definition, have as a people and as a nation, and I can assure you, as a state, the state of California. So with that, happy to take any questions.
We have Wes Benziger at the top.
Hi, yes. I am wondering if, given the projections that your administration has, if you are able to anticipate the peak of when the virus will hit and any information on how many fatalities your staff is projecting?
Yeah, we run different scenarios. We run a worst case scenario. We run very modest case, more of a flu like protocol of scenario. I mentioned the R naught. Depends where you put the R naught. Is it a 2? Is it 3? Is it 1? What is your attack rate? Is it, again, 30% or is it as high as 70%? You run different scenarios, and that's where I suggest hospitalization rates are one of them. If they're on the low end, 5%, the high end, 20%. Those are different scenarios that also require different scenario plans, not just in the aggregate, the number of surge beds you'll need, but the type of beds, more ICU, and, of course, the needs of supplying those ICUs, the ventilator needs, and the like. I'd rather not alarm anyone with some of our estimates, but I will say we've had 11 deaths in the state of California. As of last night, 472 people have tested positive in the state. It's about a 17% increase from the previous day. I know that there's been some afternoon reports of additional tragic deaths. We'll get those compiled in the evening. And I know people, some reporters, and maybe even yourself, are doing real-time, deeper dives, county by county. We try to put it together just as a time, place number on an evening basis. Again, these numbers were from last night. We'll get the new numbers, but we're running scenarios that are pretty consistent with our expectations, and we're running scenarios with our planning team behind me, particularly in relationship to a part of your question, over the next 8 weeks. And that's our real focus, is where we're going in the next 8 weeks. We want to do more on social distancing. The more we do individually, we'll reduce those rates. We are not victims of fate. We're victims only of bad decisions. We make better decisions. We can create conditions that are much more advantageous, and we can reduce the stress on personal protective equipment, the need for more ICU beds, and the need for more surge capacity.
Ben Christopher of Cal Matters.
Hey, Governor. Thanks for doing this. I have an economic question, and I know the future and the trajectory of this disease is very uncertain, but forecasters at UCLA are saying that the state is now likely in a recession, and I'm wondering, just based on your discussions that you've had with your budget analysts, do you think the state's budget reserve is going to be big enough to weather this without the state having to make additional cuts or find additional revenue? Thanks.
Well, the state's never had reserves like we had. It's just an objective fact. We paid off 100% of the debt, that infamous wall of debt in the state of California, got rid of a lot of the smoke and mirrors on budgeting, historic reserves. As you know, our bond rating as a consequence went up not once last year, but twice. All of that said, the answer to your question forthrightly is we don't know. While it's a substantial amount of discretionary reserves, we are anticipating that we need to do everything we can to meet this moment and not go small in terms of addressing the anxieties with sick leave, anxieties related to unemployment insurance, and clearly the impacts of the broader economy. You recall, Ben, just a couple weeks ago, I was talking about record job creation, 119 consecutive months of net job growth, 1 out of 7 American jobs coming from the state of California since 2011. Obviously, that's going to be substantially impacted, but we are, I will say, confidently and objectively better off to answer that question than any time we have in the past. But the magnitude of this moment may exceed those reserves, and we are operating under assumptions that are very sober and under assumptions that put this moment in perspective.
Sophia Bilal,
Thank you.
Zach B. Sophia.
Governor, you said over the weekend that you were going to issue some guidance for state workers in terms of who is essential and non-essential staff. Are you still planning to issue that guidance, and are you planning to give any top-down directives expanding telework or any kind of paid leave?
Yeah, so we have that guidance. It's quite literally being socialized. I kid you not, and this because of your proximity to the Capitol, and forgive those outside the Capitol, they may not find this particularly interesting or insightful. As we speak, Ana Montesantos of my team is meeting with all our agency heads around the directive we sent out and the response we got back. So we got the directive out. We now are beginning to amend it based upon the response. People have, let's be candid, different sense of what's essential versus what's not essential, agency by agency, department by department. So we are curating all of that in real time. Also, more importantly than anything else, also socializing it with our public employee representatives. We had a number of calls today with key representatives that have expressed some insight, some consideration, some concern, some advice and counsel. And so all of that's being brought in to the fore. So that's happening in a dynamic way in real time. And we will make that very public very soon. I'm hoping this evening, but based upon some of the feedback we got, maybe you can expect it sometime tomorrow. But we are clearly looking to push more of our workforce, non-essential workforce, to be at home, to do work electronically. It's already happening across agencies. We're just trying to really hone in a little bit more focus, a little more acuity, and to your point, a little bit more of a top-down orientation of what we expect across the board.
John Myers, Los Angeles Times.
Thank you. Governor, I just wanted to go back to the schools for a moment. I think what you said is going to come as a bit of a shock to some parents across California that you don't think these schools are going to open the rest of the school year. Can you talk about what you base that on, who you've talked to in schools, and then what about the schools that are still open and there would be some kind of different system for different kids?
Well, as we said, the vast majority, it's a very small percentage, 1.2%. By the way, that's a dynamic number. That's our estimate based upon all the surveys. This is truly a nation state. For those of you who wonder, well, why don't you know about your school districts? We have literally hundreds and hundreds of districts, some with just a few folks, some with quite literally 500,000. The LA Unified School District. So there are a number of smaller districts that are looking to close down that need to answer the question around meals, need to answer the question around distant learning. We provided this guideline today to help those districts and also help the districts that have already closed. But why am I saying it? Because you know what? I need to be transparent and I need to be honest with you the way I'm transparent and honest with my children. Last night I got home, forgive this very personal point, very long day, appropriately and understandably. Got home, there were some screams in one of the bedroom, and my wife, who was doing her best, said, "This is all yours." And one of my daughters was expressing deep stress and anxiety that she wasn't in school. Of course, never heard those words from her. I was encouraged by that. She missed her friends, and she couldn't go to bed. And she had thrown her, little bunny rabbit on the floor and pillows, most of the rest of the bed on the floor. And I was with her in a very sober moment over a course of about an hour. And I told her, honey, I don't think the schools are going to open again. And if I can tell my daughter that and not tell your daughter that or the people in it, then I'm not being honest and true to the people of the state of California. Boy, I hope I'm wrong, but I believe that to be the case based upon work we all have to do, the social distancing that we should anticipate, the new directives that will continue to come out, the changing nature of the dynamic, the work we're doing with the Department of Justice. And John, let me just be candid there. My conversation with President Trump was very favorable, as all of them have been throughout this crisis. And I told him quite candidly, we're going to need support from the federal government. We're going to need to start doing what we did last around Katrina. We did during World War II, repurposing some of our manufacturing sector to provide the kind of manufactured equipment that we need at this moment. That's a very sober conversation to have. We formalized that request to the Department of Defense. We did the same for mobile tents and mobile field units. We're going to need support of the federal government to spring up these mobile hospitals. We have put in a formal request to that degree. So those are the reasons that I'm saying that quite candidly and honestly about our schools.
Jeremy White, Politico.
Governor, thanks for giving us a minute. You talked a fair amount about schools today. A lot of folks are curious to know about daycare centers, many of which are still open. Is it your recommendation that those daycare centers should close as well?
Well, we put guidelines out as well as it relates to daycare. And we also have the benefit, and I should have mentioned this a moment ago, one of the specific things, this goes to John's question and yours, that the legislature did, Anthony Rendon leading the charge, and his very strong support in this space. They made available not just that $1 billion for discretion for my team to use to meet this moment, but an additional $100 million to really focus in, particularly as it relates to the stresses that we're placing on child care related to the school closures, and making sure that we have protective gear and to make sure that our child care facilities are clean and they're practicing social distancing. And so those guidelines are being applied and being advanced. And I can assure you, based on the magnitude of this and the fact that last week so many school districts changed that did not have those plans in place, and it put deep strain on that system outside of the school system, that we have a lot of work to do in this space, and know that our eyes are wide open in recognizing that daycare burden and stress is real. And that's why we wanted to make the point that just doing a school closure immediately would have overwhelmed that system. The fact is, substantially it was closed down, and as a consequence it has. But we again had the weekend, the last few days, to be a little bit more prescriptive in terms of our supports and help. And that is an area where we have I mentioned 13 task forces here 2 days ago. We have new task forces we created. That's one of them.
Alexei Kosa.
Governor, sorry, I just want to be clear. So you don't have a directive yet as to whether daycare centers should close, but you would like to see
No, we're supporting daycare centers with appropriate guidance, appropriate protocols. I'm sorry, they had you almost on mute. The bottom line is we need our child care facilities, our daycare centers to operate to absorb the magnitude of the impacts of these school closures. In the guidelines we just put out, and I encourage you to read the guidelines. It's not just curriculum guidelines. It's not just links to resources that we've curated and vetted. It's not just about meals. It's substantively about care. We laid out in those broad stroke guidelines additional information that I think will answer your questions. But we are not calling for all daycare centers in California to shut down, all child care centers to shut down. We are working to absorb this moment, and we're doing so in real time.
Alexei Kosa, SF Chronicle.
Hi, Governor. I wanted to ask you about the guidance you issued yesterday on the evictions and foreclosures, particularly on the eviction side. Authorizing cities to do this creates a whole nother step, and a lot of cities may not end up doing this. And so there's going to be a lot of different kind of protections across the state for residents. And I'm wondering why, if you felt it was important enough to issue this guidance, was it not important enough to create a uniform statewide order on this?
We didn't think one size fits all was the best first approach, but I was crystal clear. When we announced this, all but answered that question. Anticipation of that being a question was a question I had, a question our team had. As you know, San Jose LA, San Francisco to move forward with some local guidelines on moratorium. Again, not just for residential, but for commercial. There was some legal ambiguity. Want to clear that up. Our waiver certainly does that. But we talked to a lot of other municipalities that wanted to customize their own solutions. Again, as a nation state, it's difficult to impose one-size-fits-all solutions, to be candid with you. Some felt that was appropriate, but they wanted to, frankly, have weaker state standards than some of the locals and preempt some of the local efforts. I didn't want to go there. So I made this crystal clear. Let me make it even more clear directly to your question and everybody watching. I'll say what I said last night. I'll say what I said about 25 minutes ago when I brought the question or this issue up again. I reserve the right in real time to substantially adjust that directive based on what happens or what does not happen in real time across the state of California. If that does not imply my recognition of your anxiety and some of the advocates' concerns, it should. And we certainly will lean in if we do not think those additional steps are happening quickly enough.
Laurel Rosenhall, Cal Matters.
Hi, thank you so much. As you just said, you reserve the right to, adjust your directions and your guidance and, make things stricter on all these issues. I'm not just talking only about the evictions, but on the, stay inside and everything else. So can you talk about what that possibly could look like if you went further, and also your decision to not go there right away? I mean, are you talking about having soldiers in the street telling people to stay at home, or where could it go from here, and why didn't you go all the way there at first?
We're working with 58 counties. We're working with 1,000 school districts. We're working with 470 plus cities. I'll repeat that. You're familiar with that. Many may not be. 1,000 plus school districts, independently elected school boards, 58 counties, independent county supervisors, city administrators, city councils, city mayors, a city and a county, San Francisco. We're working in an environment of federalism at the state level, but it extends in terms of the construct of governance in a state where localism is determinative, realignment, which you're very familiar with for those that follow Sacramento closely, as it relates to county functions being absorbed with a lot of county autonomy that extends to local health directors that have real authority at the local level to direct, not just guide, not just to advance the broader protocols, but to quite literally prescribe them and begin to, at a local level, enforce them. And so we have been working hand in glove to address the anxieties that are very different, let me assure you, very different in LA City than even parts of LA County, let alone in, Sutter or Madera or Modoc County. And so we're just trying to work with everybody in real time. We leaned in. We were one of the first. In fact, we were the first state to say if you're 65 or over, we think you should shelter in place. We have been very, very, I think, aggressive in many other protocols and procedures and steps. And we encouraged the cities and counties with local conditions, the acuity of the challenges in Santa Clara being an example of that, to go further. They did. Many other counties in real time are adopting similar strategies to those Bay Area counties as we speak, and I imagine more even tomorrow. If we don't feel they're doing it quickly enough, we will encourage more, maybe the same. But you asked me a broader question, and I want to answer you honestly and affirmatively as I can. The National Guard, I have called up. We have asked the National Guard to work with us on logistics, mutual aid. It's not just the National Guard, CHP, and others to begin to regionalize strategy solutions and address what we do often in emergencies, including not just wildfires, as I mentioned, and earthquakes, but PSPS, the protocols that Californians know well related to power shutoffs associated with acute conditions, windy and dry conditions in our state to avoid catastrophic wildfires. So the answer is we're leaning in that direction. We have the ability in real time. I don't need to wait a week, a news cycle. I don't need to wait a day. We have the ability, an hour or two, based on changing environment conditions, to move more aggressively. I made this crystal clear to many of you sitting in this room a few days ago, including directly you, that we have the ability to do martial law and things like that, can layer new requirements and authority. If we feel the necessity to do that, we can do that. Federal government has the ability to do a lot of things as well. So, I don't want to get to the point of being alarmist, but we are scaling all of our considerations, and planning is no longer taking shape. It's the application now of these plans that is really where we are in this pandemic planning process. And I can assure you we'll meet the moment.
Thank you. And if I may, I have one follow-up question on the child care that you mentioned. Can you help me understand if schools need to be closed in order to have social distancing and stop the spread of this virus? How does having child care centers open to help parents with their child care needs meet the same goal? In that case, why not just open the schools and then have learning as well?
I look forward to your review specifically of the guidance we put out in partnership with Linda Darling Hammond, the Superintendent of Public Education, our Health and Human Service Director. The purpose of their task force, the reason we announced it a number of days ago, was to prescribe strategies to address precisely the question you are offering. Many districts believe that they cannot appropriately answer that question. That's why a number of districts haven't shut down. They think it's better for their district to stay open, their particular school to stay open, for exactly the reason you just advanced. The reason the legislature provided $100 million is there is a prospect that some of these schools may prefer to keep the school sites open for childcare, but want to be able to have a personal protective gear, make sure social distancing is practiced, make sure that we not just secure the sites, but we make sure they're healthy. So all of those things are happening in real time. We believe we will repurpose not just our operating rooms to potential ICU rooms, which was our conversation today to meet this pandemic, but we'll repurpose a lot of our school sites, not only for congregate meals and food to go, but also to address potentially these child care needs. Again, this is fluid. It's being adopted in real time. Your questions are the right questions. Those questions are being asked and amplified all across the state. They're being answered, but one size does not fit all. And that's the nature of a state that's the fifth largest economy in the world, $3 trillion a year economy, a state of 40 million people. And again, a state that has very different conditions depending on what part of the state, which district you're in, and which resource support you have within those districts where there's not even alternatives to childcare or daycare as you and I know it, but there may be other facilities that can accommodate where all the social distancing and the appropriate health care needs are met.
Anita Chabria, LA Times.
I'm going to go back to hospitals for a minute. You mentioned that we might need somewhere between 4,000 and 20,000 surge beds. Can you tell me what the projections are for ICU beds? How many of those projected needs can be met in the existing hospital structure, and how you're planning and how many will need to come from either the mobile hospitals or the hospitals you mentioned that you were going to bring online?
Yeah, those are being quite literally put together. The details, your question in real time, let me answer just because you deserve the answer. We have about 11,400 ICU units. That's also pediatric, not just adult. But again, that number is misleading because that's the entire system. We will need to look at that by county, by region, and resource those needs and resource a mindset that would allow me to answer your question specifically. Because I can give you a total number, but it's meaningless to the conditions on the ground in your particular community. So one of the reasons we were all together today is to really get under the hood so we could say, is it hotels you need or motels, or is it these hospitals that we're reopening? By the way, not just the two that we'll announce Friday, but others we're in the process of negotiating and procuring. Some we will lease, some we may purchase, but also other facilities. You noted my emergency declaration. Seems a month ago, it was a week or so ago, as it relates to armories, as it relates to fairgrounds, as it relates to other state buildings, state hospitals. All of those are part of the portfolio. And as I noted just briefly in passing the repurposing of existing resources. So you asked me how many ICU versus operating. We can convert operating rooms into ICU rooms. We've got surgical centers. We have elective surgery that's already slowing down. You asked me about previously the workforce in the state of California. We're looking to repurpose our workforce. That's a scope of practice issue. And we're also working with our partners to provide the human resources to also be able to answer your question. The point being, we have those scenario plans, and we're really now breaking them down in much more detailed terms: staffed, unstaffed, licensing hurdles, waiver needs, as well as procuring the appropriate supplies for each and every one of those sites.
Sosan Morar, SACB.
Thank you, Governor. When can we expect waivers to be approved for the schools, and what can working parents expect in terms of relief? We have parents that will probably go back to work before schools are in, assuming if that's the case.
Yeah, no, the most significant relief will come from the federal government, and that's a process that you know is well underway and now in the hands of the Senate. We are blessed. Every Californian already knows this. Certainly every Northern Californian knows this. I think increasingly every American, with the partnership and the representation of Speaker Nancy Pelosi. Our relationships there go deep. We are in constant contact. In fact, hospitals directly with the Speaker's office, not just the state and local government as well, to make sure that the federal government provides appropriate support on paid sick leave, on unemployment insurance. We got waivers as it relates to the 1-week delay for being able to access unemployment insurance. We have other requests and waivers in to the administration. Let me just say again, every request has been granted and in real time. So we're confident that as long as we don't overstep, those waivers will be forthcoming. In addition, we're looking at our own state supports, but that will be based upon what the federal government does and how it then translates into our state budget and into local budgets. And we are gaming out all kinds of scenarios on the support side and then on the stimulus side as it relates to a framework of economic and workforce planning that we hope will also be done in concert with the social safety support.
Christine May-Duck, Wall Street Journal.
Thanks for taking the time, Governor. You mentioned last night in your update that there was a homeless person in Santa Clara who succumbed to the disease. Do you have any other details on that? We understand that might be the first case of a person in the homeless community contracting the disease, let alone dying of the disease. And are there any details about whether that person was in a shelter, what measures are being taken given this particularly vulnerable population?
Yeah, forgive me. We know the details in terms of geographic details. And frankly, now with 11 deaths, I don't have the benefit of the individual details that would warrant an appropriate response to a very important question, because we do care deeply and are concerned about our most vulnerable residents, those out in the streets and sidewalks and our shelters. We will happily.
Real concern across the country about the vulnerability of this population, given how many homeless people have pre-existing conditions that could make them susceptible to severe disease. So shouldn't there be some more information out there about what Santa Clara County is doing to address this issue, and whether that's going to become a bigger issue within the homeless community there? And also, can you detail some of the plans that you have talked about, including where and when the 450 trailers will be deployed in California, where the timeline is in terms of procuring these other hotel rooms and beds,
Yes.
and what the priority is
Yes.
for use of those beds, whether it's quarantine, isolation, or bringing healthy seniors to keep them away from sick people.
So I'll take a backseat to no one in meeting the issue with a deeper sense of urgency. As you know, my entire State of the State was dedicated to the issue of homelessness in all its forms and manifestation, both from perspective of prevention, preservation, and production on the housing side, from a brain health, not just a physical health perspective. We talked deeply about Lanterman-Petraeus Short Act. We talked about our new reforms through our reforming of the Medi-Cal system in the state of California. I requested an unprecedented $750 million from the legislature and a new homeless fund. We, as you know, procured old FEMA shelters that were in our possession, and we distributed those to the counties. As you know, yesterday I announced in record time, quite literally over the course of 48 hours, we were able to procure 2 hotels in Oakland, and then we are in the process of transitioning those 2 hotels, 393 units, to the county. We are negotiating with 901 others. Again, can't be more precise to you than that. Tens of thousands of rooms in that portfolio, not just for the homeless, but also potential surge capacity to meet the broader needs as it relates to this pandemic. We are deeply focused on the needs. We don't need the advocacy community to highlight those concerns. We deeply share them. Frankly, we're highlighting them not just at a local level, but substantively at state and federal level. As it relates to new mobile home parks, not just trailers. We have 113 mobile home park units that we are procuring. We've got another 100 traditional trailers that are being distributed in real time. I will give you the information specifically where they're going. As we get more inventory and more hotels, we're going to not only announce them, we're going to be announcing the partnerships and what communities they're in. I'll continue to remind you what I said last night, what I said now 35 minutes ago, and that is we're prioritizing seniors off the streets that are homeless, and we're prioritizing those because of those comorbidity, morbidities that you referenced, and the compromised immune systems that you appropriately referenced as top priorities as it relates to concerns around contracting COVID-19. And those protocols will be delivered at the local and county level, not at the state level, but the guidelines have been advanced.
Final question from Rachel Becker of Cal Matters.
Hi, thanks, Governor. So you said there are 78,000 staffed beds in California with a surge capacity of just over 10,000 and 11,400 ICU beds. How many of the conventional beds and the ICU beds are already occupied?
Well, these folks have been standing for so long, and they're going to wonder why they were here in the first place. But you are the head of our hospital system here, and who better to answer that question? And perhaps just give a broader sense of how everybody's doing and how you're feeling.
Will do. Thank you, Governor. I am Carmela Coyle, and I serve as the president and CEO of the California Hospital Association. I want to start by thanking this governor and his healthcare team for the partnership. The governor has talked about meeting the moment, and we as the healthcare delivery system are here to meet that moment together. I'd really caution folks in thinking about the numbers of beds and ICU units and all of the rest, because as the governor has said, we have an ability to shift and reshape and change that capacity based on our needs. And one of the most important things that we're doing right now in partnership with the state is working to stand up this alternative care capacity. So the more people who are in the hospital now who don't need to be there because they're not acutely ill, if we can move them out of the hospitals, we are just by that very nature creating more capacity for those folks, both COVID positive and others who may need our care.
Are you considering using the hotels for that?
I'm sorry?
Is that where the hotels come in? Are you considering using the hotels that you are procuring for that?
We're working in partnership with the state, and I think it's a whole variety of options, whether those are the hospital that we can stand up, whether that is use of hotels for other patients. The important thing is that we want to maintain and reserve the hospital capacity for those individuals who are acutely ill and in need of that hospital care, and make certain that we're getting creative about any other options that are out there and available to care for the needs of others.
Under the various infection scenarios, how many hospital and ICU beds are we short? And are there any of these scenarios in which the existing number of beds are sufficient to treat all of the pandemic patients as well as other sick people? And before you answer also, will you be making these epidemiological projections and the assumptions you're making about the R0 and the attack rate public? Because this is important data for knowing the bounds of the epidemic as we cover it.
Let me answer the capacity question, and I'll turn to the governor on the epidemiological models. On the capacity issue, look, hospitals deal with emergencies every day, and especially hospitals in California, whether that is wildfires or earthquakes or mudslides. This is a different kind of an emergency, but this is something that we do and prepare for each and every day. Our capacity will be stretched, and as the governor has said, it's not just the physical capacity, it's also the human capacity and the supplies that we need to care for all of those as part of this national emergency. So we're going to be working on all of that. We are tracking it. We are partnered with this state team, and we're going to stick to our mantra, which is stick to the science, stick to the facts, and stick together. But I'll turn it back to the governor to answer about the model.
And let me, I'm going to ask my doctor, Dr. Ghaly, to come up and talk more about that. But I also want to note that we have also requested support for the federal government, the DOD, on these field medical units. And we are also encouraged by the fact, you may recall, it seems years ago, the Grand Princess was the focus of your attention, focus of all of our attention. They have Navy ships off the coast of California that have medical capacity. Those medical ships are, we believe, uniquely positioned and conditioned to help support the efforts of the state of California as we plan for the pandemic in some of the worst case scenarios, but we are going to need the support of our federal partners, and we have formal requests, and again, the purpose of the call with the president today on some of these mobile field hospitals. But on the epidemiology, on the R0 question, on the attack rate question, on the percentage rates of hospitalizations and deaths, and putting all that information out there for everyone to chew on, to react. Some underreact, some maybe overreact. I'm going to leave that to Dr. Ghaly to answer.
Yes, we're working constantly on refining our models. We started a few weeks back creating what was the first in the nation model at looking at what the spread of disease in a nation state of nearly 40 million people looks like. We continue to augment that with rich information from our various counties. The hospital systems and the leaders behind me inform that as well. And we refine based on the international experiences, what we're seeing in Europe now, to hopefully stay in front of what we're seeing. So as we report more cases in California, even deaths in California, we are preparing to scale up the number of hospitals that the governor mentioned that we are planning to bring online. It started at 2, one ideally in the north, one ideally in the south. We are now talking about more of such facilities, thinking about how we use the hotels to meet that demand. So we're using the model, refining it to build capacity as we go along. I want to just highlight one issue or comment that Carmela made, which is that we need to remain flexible in how we use our resources. We know that California is a very large state where we're going to see certain counties, certain regions affected earlier and deeper than other parts. And we are committed to working not just with our hospital partners, but our clinic partners, our healthcare partners, our nurses, our first responders, to ensure that that surge capacity shifts to meet the moment in the region where it is needed most. And we look forward to continuing to refine these models, ensure that we have the best information in science, the best ideas on how social distancing is protecting and supporting our communities, so we put it into use to guide the decisions that those behind me will be making with us and many others across the state as we build up our response to this national issue.
I believe that's the last question. Let me thank everybody again for the privilege of being able to give this update, answering those very thoughtful questions, and let folks know we'll continue to make ourselves available. And I just want to thank everybody that took the time to be here, not only physically here behind me, but all the incredible work each one of you are doing every single day to meet this moment, making California proud. Thank you.